Hi,
So,
Katie.
Dr. Elena, I
What are we
almost don't
talking
want to.
about today?
Oh, I don't want to. I almost don't want to ask these questions, but here it goes. I don't know the difference between perimenopause and menopause, except that perimenopause and then you are in regular menopause. And I would like to know at what point I can be sure that I'm in perimenopause. And I don't know, which I expect it to last.
Ooh, it's a loaded question.
Oh boy. Okay.
All right, so we'll start kind of backwards. We'll start with menopause because menopause is menopause and pre or perimenopause is the time before menopause. So menopause is when a woman's ovaries retire and they stop producing hormones.
I love that you call it retire.
Well, they
They've been
they
working
deserve it,
hard.
you know. They worked really hard, so they deserve to go on vacation permanently.
Indeed.
So the production of hormones is now being deferred to the adrenal glands. And that's why it is very important to lay the foundation and focus our attention on improving adrenal gland function and resilience even prior to women going into menopause, because the production of the hormones will reside solely in the adrenal glands and some from adipose tissue. We're talking
And
for
is
women.
that where don't men produce most of their hormones from their adrenal glands?
And the testicles.
But isn't it mostly adrenal glands for them?
And testicles.
Okay. Okay.
Yeah,
Sorry.
the
Carry on.
testosterone is produced in the testicles, and they heavily um, um, bank on that testosterone production, right?
Okay.
And they don't cycle, so they have that testosterone support for much longer than we women do.
At one point I read that um the reason why women typically need more sleep than men is because most of our hormone functionality happens from our ovaries or whatever, and that system needs more support through sleep, whereas men use more adrenal gland to produce their hormones, and so they typically are able to function on like an hour less sleep a night than women, but that could just be trash science. I don't know.
I'm not aware of any kind of clinical trial, and I'm sure that there's lots for me to learn in that regard, so I can check it out and research it and get back to you. But sleep is very important
Well, no
for
comment. I've never.
cellular metabolism. Now it may be true. I just don't know. Again, I don't know everything, but I can certainly look into it. Both women and men need sleep. This is when cellular detox, kind of taking the cellular trash out, is happening, and it helps with regeneration of the cellular matrix and function overall. So sleep is very important for both women and men. And going back to menopause in the United States, the average age for women experience or going into menopause when their ovaries stop the production of the hormones is around the age of 52 or 53. So what is peri or pre-menopause? Is that period of time when hormones start fluctuating before the ovaries completely retire. Now, that period of time can be 1 year before menopause, but it can be as long as 10 to 15 years prior. So it's a very long period of time during which women will experience these hormone fluctuations that will reflect, or women are able to recognize them as symptoms of. First thing to go out is sleep disturbance, the most complained of by women. Sleep disturbance, inability to either fall or stay asleep, and that relates to both estrogen and progesterone, hot flashes, night sweats, irritability, mood swings, anxiety, tearfulness, loss of libido or just decrease libido, just not feeling well, not having the energy, the stamina that they used to have. And sleep disturbances do not allow for that cellular regeneration. And therefore they would feel more tired during the day, which is a vicious cycle because it causes a disruption, a dysregulation in that blood sugar, and it further affects the adrenals. So the brain, adrenal, ovarian axis are very important. They do communicate with each other. The gut is also important because it helps produce and metabolize all of these hormones and neurotransmitters. So the health of everything is interrelated, and it's very important to be made aware of as a patient who probably goes to see a gastroenterologist, a gynecologist, a primary care physician, an endocrinologist, and all of that. And guess what? None of these physicians tend to talk together. I don't know why. But all of these symptoms are interdependent. So helping modulate them would be ideal. I do all of that because I apply functional medicine principles. Look for the root cause behind these symptoms. These symptoms are a reflection of something going on in the body.
So the symptoms you described about perimenopause just sound to me like a regular, like a period, like a menstrual cycle somebody would experience, right?
Yes and no. They can happen throughout the cycle, or they can happen just before the menses. So if it's happening just before the menses, what we know as premenstrual syndrome, or even PMS on steroids, also called PMDD, that happens usually 7 to maybe 10 days prior to a woman's period. So if that is the case, then we have to look into the cycle and figure out, is she ovulating? Is she not? Is there something in her lifestyle that needs to be modified, changed, maybe add supplements, maybe change dietary habits, maybe introduce exercise, improve that adrenal stress resilience, and definitely sleep, and changes would follow versus she has a decreased ovarian production of progesterone. Adrenal progesterone is used as a precursor to support that cortisol for stress effects, and maybe she needs that additional supplementation of progesterone to kind of restore that balance between estrogen and progesterone. But I want women to understand that it's not just a balance between estrogen and progesterone. We also make androgens, and we actually make more androgens than, or more testosterone than estrogen. Okay, so testosterone is very important in regulatory functions and balance of these hormones. So don't just look at estrogen and progesterone, look at the entire picture, find the root causes, treat the root causes, and then add any kind of bioidentical hormone support if necessary.
So is it problematic, like with the exception of the way that life feels when you are having perimenopause, is it problematic for any other reason to have a longer or shorter time in perimenopause? Like if you're in perimenopause for 5 years, obviously you're not happy because you're having these symptoms going on, but can it like lead to cancer rates? Is it connected to Alzheimer's? You'd want to try to delay it?
It is related to both, and the idea is not to delay it, but to prevent it.
You want to
Nobody,
prevent perimenopause.
right? You not prevent menopause, prevent Alzheimer's, and prevent breast cancer, and all of those things that are associated with imbalance in hormones. So we want to prevent them, not just delay them, right? The period of, or the length of time that a woman is in perimenopause only matters if it presents with symptoms that alter the quality of life. Because that means that if a woman is for longer periods of time under the unopposed effects of the estrogen, then she will have an increased risk for cancer. As the opposite is also true. If her estrogen is extremely low, not balanced with estrogen, she loses the beneficial effects of the estrogen. That genitourinary health, sexual health, mental stability, prevention of loss of bone matrix loss, so, and prevention of cancer, because cancer actually increases as estrogen decreases.
Wow.
So all of that matters. there are women that are fortunate that go through perimenopause without experiencing a lot of symptoms, if any, from this hormone imbalance. So therefore, they don't really know that they are in peri or pre-menopause. They only know that they're in menopause because their cycles have stopped. And what marks menopause? An arbitrary pick of lack of cycles or lack of period for 12 consecutive months. But does that mean that we let the woman suffer for 12 consecutive months just to put check mark that, well, now she's in menopause and now we can start supporting her with exogenous hormones? No. We apply hormonal exogenous treatment only if necessary and only after we have corrected the root causes that have led to this hormone imbalance in perimenopause. So any kind of botanical support and supplement nutraceutical support in perimenopause are supposed to restore that balance and kind of bring back your natural production of hormones. But once you get to menopause, these botanical supplements and essential oils and things like that are not able to stimulate any more production of hormones from the ovaries. So they're only going to work minimal because they will support the production of the hormones from the adrenal glands if they're healthy.
I feel like my jaw's just been hanging open for the last 5 minutes. Like I have to like
I'm
fix
sorry,
my
maybe it's a
face.
lot of information. I don't mean to overwhelm you or our
Well,
audience.
no, I mean I think what's overwhelming is really considering the reality that the vast majority of women I know will unknowingly be suffering unnecessary years and years and years of their lives.
And you are right. That's the reality. Because of lack of awareness and lack of promotion of this awareness through conventional medicine, primary care follow-ups. This is our main go-to type of information, right? You go to
Yeah,
your
and
primary care when you have a medical question. So if there's no training to back that up, unfortunately, the primary care is not able to really help you. And that promotes that old taboo that as a woman, you're supposed to go through these changes.
yeah.
So just suck it up. You'll feel better once you get to menopause and your hormones drop.
Mhm.
And of course, you'll feel more miserable, but that's also woman dependent, depending on that, set point of hormones prior to menopause. But it shouldn't be accepted as normal because it's not really normal. And especially when perimenopause can last 10 to 15 years, that's a long time to let go of a good quality of life when it certainly could be different.
Well, yes, and in many cases, that's the time of life when women should really be the happiest or the
Yes.
least encumbered, really. And so
Yes.
it's tragic that we have a narrative that's not reflective of how good.
But
All
we can
right.
maybe
Well,
do our part to increase awareness a little bit and maybe encourage women to seek out help instead of settling for these life-altering symptoms.
absolutely. I hope that is what we're doing.
I hope so
I
too.
have a million more questions to ask you, so I think we can leave this one where it is. Thank you so much for blowing up some myths around perimenopause and menopause. Certainly talk about this topic again, I'm sure.
Pleasure to be here and recording with you. So audience, stay tuned.
Thank you.